Hi, my name is Roni Zeiger. I'm the co-founder and CEO of Smart Patients, and I just got off stage from the Healthcare IT Summit where I talked about bringing user-centered design into the work that we do in healthcare IT. While it's difficult to keep track sometimes of who our users are because we have complicated budget constraints and there are physicians and hospital administrators and patients, if we always remember that everything that we're building has real end users and we think about how they're experiencing our products and how we can learn from them to make our products a little bit better, we will do a better job each year and get to a point where we can be extremely proud of our work. So Smart Patients is an online community for cancer patients and caregivers where they look to each other for help. And that's because they have experience. Many of them learn a huge amount about their illness, and they're really eager to learn from each other and with each other. So it's a peer-to-peer system for cancer patients and caregivers to learn from one another. So I think we're in the Stone Age in terms of how immature most of the products and systems that we use are today. Part of it's because in the big picture, technology is still new, but mostly while technology has really matured in many spaces, especially in the consumer world, healthcare has so many complex moving pieces and constraints, both regulatory and I think even more so cultural, that we are very slow adopters and we iterate slowly. So the industry leaders today are there, I'll be a little bit bold and say, are there not because they're the best, but because they're the least bad at what they do. And I'm convinced that even 10 years from now, certainly 20 years from now, we'll look back at the quality of the software that we're using and chuckle a little bit. I think the most important thing that we can do to directly improve the quality of the services that we're delivering is that on a regular basis, say every quarter, explicitly decide on 2 or 3 or 4 experiments, most of which are supposed to fail, but that we can use as tests to think about which directions to go next. And just like the way we order tests in medicine, know ahead of time how the experiment could go and plan, depending on its result, how that will affect what we do. So I think more regular testing, failing, experimenting, which is something that we're usually not comfortable doing in healthcare without the cover of an IRB or something like that. But if we remember that we're just building software and deploying it and real people are using it, what are ways that we can experiment to test some of the waters of what we might do next and have those experiments feed back into our next decisions? Well, certainly keeps me humble. I think being a doctor today could be the hardest job on the planet. The science behind medicine is changing unbelievably quickly, and the tools that we have to practice medicine are not. They're changing very slowly. So we have to do more and more with less time, usually less compensation, and that means that it's becoming more difficult. I'm reminded every time I'm in clinic about who the real end user is and how hard it is to be a patient. And in the face of all those challenges, it's extra motivation to think about, so how can we do this incrementally better by focusing on what it's really like to be a patient and what it's really like to be a doctor. And I think that helps keep me honest about that, for example, the shiny, cool new technology is not necessarily the right answer or not the entirety of the answer, and focuses me on asking the right kinds of questions and helping other people ask those same questions. So I'm a geek and I love technology sometimes for its own sake, and I think that's dangerous. So I think Apple is the best current company that's leading the way there. They are doing a huge business because for the most part they're sexy. And I mean, maybe that speaks to how much of a dork I am that I think Apple is sexy. But I think it's really important as we think about what problems we're really trying to solve. We're not just selling widgets in healthcare. We're trying to make subtle improvements in complex systems and complex people. And it's very easy to look at our next decision, a purchasing decision or a product decision, based on how cool a technology or a demo is, and forget about and lose a little bit of sight on, well, what problem are we really trying to solve, and how will this help our end user do what they need to do better, and not necessarily just how great of a case study is this going to make at our next board meeting. I think sometimes the answer is doing a smarter job of using a current old school technology than necessarily replacing it. Sometimes it's absolutely necessary to replace something. I think a fascinating data point, so I like to rib Epic for being a market leader and still only having mediocre software. The reality is they've done a spectacular job of building software that follows the workflow of real doctors. And the fact that they are a market leader while still having millions of lines of Visual Basic code that's officially deprecated from a Microsoft perspective is a great testament to the fact that the answer is not always to use the shiny new technology, but sometimes to just get the job done. So I think 6 or 12 months from now, we won't be much farther than we are today. This is a field that unfortunately changes slowly. And that's why I think we need to get better at designing small experiments and to learn from those experiments in ways that really let us do our jobs better. The answer is not going to be replace our system every 4 years with the next system. It's going to be how can we get smarter about the way we use systems, put them together, combine them with homegrown analytics or pieces that help us fit the specific use cases in our institutions. And so I think we're, it's not the sexiest answer, but we're in a period of hopefully quick iteration and incremental improvement, so that not 6 months from now, but 5 years from now, we can look back and say, wow, we've made a tremendous amount of progress.